those things may happen. All right. So today, what am I learning about COVID-19? I'm going to share my screen and I'm hoping it works this time. I'm hoping it works this time. If not, I am recording this. So either way, either this video will be uploaded or uploaded and put on our Facebook page, and shared through our Instagram and Twitter outlets. So what am I learning from COVID-19? So today I really want to talk about the reality of COVID-19, of just some things that I personally have experienced, at home, but then also the work that CommunityBuild Ventures does in the community. And so the first thing, how I like to start off with is just telling you a little bit about CommunityBuild Ventures, who we are and what we do in the community. So about CommunityBuild Ventures, we are a consulting firm that is committed to eliminating racial disparities by developing powerful, impactful, racial equity-centered leaders and organizations. And so how we do this is that we help folks learn and practice embrace face, center racial equity, and heal through the process. And we do it through 3 areas. Thrive Design is one of the areas, which is our racial equity-centered design and impact analysis. Learn and Practice, which is our way of providing experiential learning opportunities to deepen individuals and organizations' practices in racial equity. Healing and emotional self-care. This is where we help people explore healing and emotional self-care practices. And so we weave healing and emotional self-care practices throughout any of our engagements with organizations. And we also provide healing-centered engagements, that's healing and emotional self-care only. And we really, what we try to do, what is our goal is to have a healing justice framework to it that really centers rest and centers the living experience of Black people and Blackness and what that means, and in the hopes that it will help all of us heal and all of us explore self-care practices that resonate with us. And so that's CommunityBuild Ventures. You can contact me if you want more information. Definitely put in the comment box if you would like for us to reach out to you and or provide us your information and we'll reach out to you. All right, so one of the things that we love to do at CommunityBuild Ventures is that we love to center Braceface Building as we start our work. And for us, Braceface Building is a 6-step process that really helps people to be more authentic and more engaged and really tap into their own courage and bravery to stay engaged in a conversation that centers racial equity. And so Braceface Building is a 6-step process that centers, first and foremost, how people are feeling at this moment, but then also helping folks to, I would say, think about gratitude, really lifting up gratitude, because that helps people at that moment to just see that there is some good things, like what's good, right? Not necessarily being wrapped up in all of the trauma, especially at this time, but what is good going on right now in your life, whether that is, hey, I'm with family, or hey, I'm still working, whatever that is, but it allows that energy to really focus on that versus focusing on the trauma And so we like to start with Braceface Building. And before we go there, I want to acknowledge that the video live is going in and out. So you may be experiencing cut in and out of this. And so I am continually to record via Zoom so that you will have access to this video later if for some reason this video cuts out again. And again, I want to start with Braceface Building. And part of Braceface Building that I want us to focus on right now is how are you feeling and what are you grateful for at this moment? Okay, and I'll just pause there for you to think about it for yourself. How are you feeling and what are you grateful for at this moment? All right. So I will share. So how I'm feeling right now, I'm feeling rested. I had a really good night's sleep. I am still feeling concerned, right, about just the pandemic, but then also my family has suffered a great loss. My father-in-law is now new ancestor. He passed away on April 1st. So just really concerned about not only the pandemic, but then also thinking about not only my family and friends, but other folks in our community that are also experiencing loss unrelated to COVID-19 and how they are dealing with memorializing, having ceremony around the death of their loved one. So just very concerned about how people are dealing with that and moving through that. And then at times I feel overwhelmed, but not as much. I'm figuring out a pace, and I'm feeling determined. What I am grateful for at this moment is community, friends, family, the ability to work from home, the fact that I am still generating business and income for not only myself, but for the company and the beautiful people that work with CommunityBuild Ventures. I also want to lift up those same folks, the consultants that I have the pleasure of working with who have been so supportive, and we have been working together to demonstrate a new way of working together, of having business. So just very grateful for that. And I want to add to this, I didn't share in the Braceface Building, we always do intentions. And so my intentions for today is that I just want to lift up some reflections about the reality and some key articles that I have come across in the past week, and then lift up some resources to help us in our own mental health, and then also physical health as folks are thinking about, hey, should I be tested for COVID? Should I, you know, yeah, just all of those things, just kind of thinking about those things in terms of my reflection. The other thing, in terms of Braceface Building is thinking about, your communal tools that you want to use as you go through, for us, right, centering a conversation on racial equity. But what are your communal tools? What is your personal self-care tools related to mental, physical, spiritual, mental, spiritual health that you are using that is helpful for you on this journey? And so right now, I'm going to pause here because I am trying to get back on live. So please bear with me. I'm going to try this a fourth time so that we can stay connected live. And so I am back on. I'm going to, I think I'm back on. Let's see if this works again. And again, like I said, I'm going to continue to share my, continue to talk through this because I am recording this still via Zoom, although this continues to cut in and out. And so again, what are your intentions? Oh, I'll back up. What are your feelings? What are you grateful for at this moment? And what are your intentions during our conversation today? Again, these are just things that we use as Braceface Building tools. And then just think about also what are you doing mentally, physically, spiritually, in order, in terms of your self-care as well. All right, and as I mentioned earlier, I really want to center on some of the realities. Yesterday, I kind of talked about how I am thinking about ancestry to help be a guide for me so that I can move towards more of a growth zone versus a fear zone as we go through this pandemic. And I'm using ancestors as a guide of how they dealt with things that were unprecedented, right? That are unknowing, uncertain, and some of the most inhumane atrocities that they've experienced through slavery, through attempted genocide, ongoing section killing, all of those things. And so how that they continue to move forward. So today, and you can catch that video on our Facebook page, which will be uploaded either today or later on today. Today, I want to talk about some of the realities that I personally have experienced and my community has experienced related to COVID-19. So one of the things that I've been hearing a lot, and also this is a word that comes up a lot when there is a collective traumatic experience, right? Yeah, when I'm just trying to think of an incident like Hurricane Katrina, like any of the hurricanes that hit hard in Texas, right? The word equalizer comes up a lot of times, right? Such and such, X is an equalizer, whatever that is, right? So I've been hearing a lot people saying COVID-19 is an equalizer, right? And for me, because my passion, my purpose, the work of my company is very centered in racial equity and having a framework and understanding how racism colors our entire world here in the United States and beyond, right? Colonialism, imperialism, all of those things. When any collective, like traumatic, in such the case of this pandemic, happens, the people that are most marginalized, most disenfranchised through racist practices, structural racism, institutional racism, are continue to be disproportionately affected. And also the challenges, the disparities, the access to them, the lack of access becomes wider and wider. When we think about racism, we are all not starting at the same level, right? We're all not starting at the same level. And that means when something like COVID-19, a pandemic happens, and those communities that are already below, right, the level foundation, they will continue to get lower, and lower. in terms of, we're seeing right now in terms of the health disparities, right? Black people and brown people at an alarming rate are contracting the virus, and are not getting the treatment, right? Because one, we're not believed that this is really a reality that's happening to us. Also, a lot of Black people do not have access to adequate professional health care. A lot of times we're left to our own devices and trying to figure out and navigate. Access to the insurance needed to get to the adequate health care, right? Disproportionately, black and brown people do not have access. And so it is not an equal out. We are not equal. We're already below. And so that means our efforts in terms of relief, in terms of, mutual aid and funding, has to specifically target those communities, and specifically target and support those Black and brown-led organizations that are on the ground, most of whom are grassroots, to get access rapidly and easily to the funding that they need. And so I want to, just really share this quote from Dr. Kamara Phyllis Jones. And in one of the articles that I have been viewing this past week, and her quote goes as follows. She says, "What's happening is Black folks are getting infected more because they are exposed more. And once infected, they're dying more because they have their bodies, our bodies, have borne the burden of chronic disinvestment and active neglect of the community. When I look at it is because of structural racism, which puts us in the forward-facing jobs, right? Those frontline workers, right? I'm doing a bracket, frontline workers that are now, right, essential. We are in forward-facing jobs so that we are exposed and less valued and don't have the protection we need." Again, Dr. Jones is a former employee, former leader at the CDC, a family physician and epidemiologist, and I would say she is a noted expert on structural and institutional racism, and really has unpacked the history of health disparities as it relates to Black people. And this quote comes directly out of an article, "Why Blacks are at higher risk for coronavirus." I'm pulling up this article right here. So when you have a moment, check out this article. This is a CNN article. It was put out on yesterday, April 7th. And so definitely check that out. The other thing is that one of the other things that an article that I read is that early data shows African Americans have contracted and died of the coronavirus at an alarming rate. And this article, again, in context, which I've just said, gives a broader context of the reasons why Black people, and I say Black people very intentionally because I'm including people of the African diaspora. That's our Afro-Latinx brothers and sisters, our brothers and sisters in the Caribbean, and the continent of Africa, through South America, Central and South America. So I'm especially including them because they also make up our communities, Black communities. And so again, Black people have contracted and died of the coronavirus at an alarming rate. And what this article illustrates is the long-standing racist practices and policies that are embedded in our structures and in our systems and within our institutions have amplified, right, the rate of Black people being infected with this, right? And so some of that, of course, has to do with the already known health disparities, right? Some of them, access to adequate health care, access to, I'm thinking about these young Black brothers and sisters in Chicago that are activists that fought and got a trauma center in their community, So we have to do things, Black folks have to do a lot of things in order to get the minimum resources in their community. And so one of the other things is that we are also on the front line. We're the frontline workers, as Dr. Jones shared. We are now, some of the positions, the low paying, low wage, right, jobs are now considered essential, which means that's putting more Black people, more brown people at risk of contracting this disease. And we also know that a lot of these businesses are not adhering to the standard policies that the CDC, as well as their, local governments have said in terms of the work conditions, right? The other thing is, access to insurance. Again, Black folks have traditionally been, not had the access, again, disproportionately high rates of not having access to adequate insurance, right? The insurance premiums are too high. Just even the cost of local clinics is just out of the means for a lot of folks in Black communities. And we also already know kind of the disproportionately high rates of maternal death, low access to medical care, high rates of asthma, high rates of heart disease, high rates of diabetes, right? Many of these things are definitely stress-induced of living in a marginalized, disinvested community, which is now even more amplified because of COVID-19. And so this also, because of those like high rates of asthma and heart disease and diabetes, means that people that are experiencing those things have, greater risk of dying from the disease because their system is already compromised by another ailment, right? And so this means for Black folks, this is alarming, right? This is one of the reasons why I'm feeling concerned, because this is alarming. I have diabetes, in total transparency. And then also I have, family members like my dad, like my mother-in-law that have diabetes, and, and heart disease is all through my family and community. We also have a medical history of cancer. So all of those things I'm thinking about and trying to ensure not only my own local community and my family, but just thinking more broadly of how can I help other folks that look like me, my people, to be safe and not contract this horrible disease, especially if they're already dealing with a known virus or disease or ailment already, which we already know disproportionately affects Black and brown people. So I just want to, just share that also, this article here that kind of talks about it, and then also talks about Milwaukee's response to that. One of the things that they're doing that is very helpful, that all medical departments of public health should be doing, is disaggregating the data by race. Go figure, right? Just releasing the data about race, because the most affected, right? If you figure out how to stop or flatten the curve around people, Black people, particularly in this country, you're going to help everybody else. If we figure that out and help Black people be safe from this virus, to flatten the line, to make sure that they don't die from this virus, of being very intentional of people who have, Black people who have current ailments around that, this is going to help our entire country to stop the spread and or flatten the curve, right? This is what we've been hearing, just flatten the rate as we think about it. And so public health departments need to do that. They need to be honest that this is the reality. There's going to be a higher rate of Black folks, just as there's going to be a higher rate of unemployment through this. for Black people. There's going to be a higher rate of Black-led businesses that are going to go under because of this, because all of this is access to the resources that have traditionally been kept from this community. And so we have to be honest about that. And one of the best ways, the first step is ensuring that public health departments are disaggregating data based on race and thinking about what is a racial equity center approach to COVID-19 in their community. What does that look like, right? So again, the COVID-19 virus, right, this coronavirus is not an equalizer. So I just want to bring that up. I also want to share this this article as well that talks about the South in particular, that the coronavirus is a unique threat to the South, and particularly young people in the South, believe it or not, which is a little different than the information that we've been hearing nationally. And what this article really talks about, again, as I said before, you know, Black people are already living under harsh disparities that honestly are causing us to be sick, that's killing us already without this virus, right? And so this means that in the South, particularly where you definitely have a higher concentration of Black people, right? It's no wonder that they are projecting, right, that the real spike, the real area to focus on are these communities in the South. And then also I want to add to the reason why this article talks about is that the governors, the local leadership in these states have failed to be really responsive about COVID-19, right? In my state of Georgia, our governor finally put a shelter in place because I guess he had an epiphany, or he finally read a medical report around, you know, COVID, a carrier could be asymptomatic, right? You could not show any symptoms and be spreading the virus around. And so finally that prompted him, that was a catalyst finally for him to say shelter in place, right? And so I am, you know, appalled and dumbfounded, like I just can't even think of just like how he finally arrived at that when this has been known information almost since the beginning of the spread of this. But I digress. I just want to, you know, again, share the South. We're seeing alarming rates of young people in the South, particularly, of course, Black people contracting the virus through current ailments that folks already have, through the lack of response. And then also our departments of health are not disaggregating data by race and really looking at what is causing this and really thinking about a racial equity centered approach of how do we, you know, stop, how do we flatten the line, how do we treat, how do we really listen to Black people when they're saying that this is happening to them, and really give them the test and the treatment that they need and support. And so I just wanted to, again, lift up kind of the reality, something that has been, that I have been experiencing, this word equalizer. And again, COVID-19 is not an equalizer. And then I want to lift up a op-ed done by a noted journalist, columnist, Charles Blow. I follow him a lot. And one of the things he talks about is social distancing is a privilege. And as Dr. Jones said, that most of the people that are on front lines that are quote unquote essential workers now are Black and brown people, which means they are going to be exposed more to the virus than anyone else. And so he talks about that it is a privilege, right? I am very clear that that physical distancing, I also want to make that distinction instead of saying social distancing, but physical distancing is a privilege, right? I'm at my home. You know, I feel comfortable. I can still work. I have access to Wi-Fi. I am able, right? I, have a computer. I have technology and access to different apps. I can pay for said apps if I need to. Most of the people that I'm connected with has access to those things. And so again, I'm very clear about my own privilege. Then I'm also very clear the experiences of Black and Blackness that most folks, I'm thinking about my brother, I'm thinking about his wife, who are still working on the front lines. They have 4 children, and I'm very concerned about their health and well-being and the nature of their job. They're interacting with different people every day. My sister-in-law shared just the sheer number of packages that she's delivering as an employee of a delivery carrier. She shared 250 packages in one day because it has increased and she's considered essential. So she has to deliver all these packages to all of these houses. And I can't imagine, how she is navigating that, right? And then as safe as possible, but these are all different homes. And these is, and as we know about COVID now, as we're learning more and more about how you can contract it, I'm just, staying prayerful that she doesn't come across that in her airspace, her 10 feet airspace, right? So again, social distancing is a privilege. And again, it goes back to what I'm sharing. COVID-19 is not an equalizer. The next thing that I want to share is that, oh my God, I thoroughly am grateful and appreciative to how many people, how many organizations are saying, I'm going to provide this resource. I'm going to set up this fund to give out to people. I'm going to deliver food. All of these things, I'm going to help people with energy assistance, all of those things. But the flood of information, like for me, I know I get 6 or 7 emails a day of a litany of resources. And it can be overwhelming and debilitating, especially when you're talking about a community that, again, disenfranchised, disinvest, mass and constant, persistent disinvestment. And then also the trust factor. I don't know which resource is real, right? Is this the right one? And all of this is coming through my door and people are telling me all of this in my community like never before. And so for our most disenfranchised, marginalized communities, it has devastating consequences. We may say that, oh my goodness, we're offering these services. Oh my God, they're gonna come, and because we have all these resources, these folks are gonna take advantage of it. Oh, they're gonna take advantage of it. But what happens is, what really happens a lot of times that we see in our work in our community, when there's a flood of resources or information, it's hard to navigate because one, I don't trust you. I don't know you. I don't know if it's real. We've heard this before, right? In Black communities, or we think it's a scam. It's not true because of how we have been traditionally treated, right? And so and then also it's a lot. Then you're just like, okay, I don't even know until I hear from somebody else. I'm not. And what will happen is, because people are not running up to the doors of these organizations or resources, I have heard plenty of times from well-meaning, well-intentioned organizations say, oh, they did not want the resources, right? And that is not true. It's not that they don't want it. They don't know how to decipher. They don't know you. You haven't done the work around really community engagement in a way that builds, shares, and wields power. And so they don't come. And so what we're offering, I have gotten, you can imagine the hundreds of resources that I have received. And what I've done is kind of narrowed it down to clearing houses, kind of one-stop shop for folks. So if you're in philanthropy and foundation world and you really want a racial equity centered approach, you don't want to harm, do no harm. You really want to be thoughtful in your investment and engagement of communities. I've shared a listing and an article to read to like how to center your giving around racial equity, racial equity framework. And then I've offered 2 resources that are really supporting organizations that that come from our most marginalized communities, the most disenfranchised, which are by and large Black, that have some intersectionality also with the LGBTQ plus community, also Brown community, Indigenous community, Asian and Pacific, Asian American and Pacific Islander communities, so that you have access of where to give your grant making and donations to that will get to the communities most affected by this. The other thing is, so nonprofits and small businesses. So I'm a small business and I've been navigating, oh my God, where are the grants, where are the loans? What should I do? I've offered one resource, and this is the most amazing resource that I've come across. And Duke University, the Fuqua School of Business, I hope I'm pronouncing that right. I apologize, Duke University, if I'm not pronouncing that right. They have created an app that is not only a regional, national, and international resource for nonprofits, entrepreneurs, small businesses to navigate all of the cash-related resources, capital resources from loans, grants, and cash that you can ever think about or know. And again, if you're in Texas, they have resources there for you. If you're in Atlanta, there's resources there to connect to, and they're updating it almost daily. So it's going to get you connected even as you're thinking about navigating your own local resources. It is there. That information will be up shortly via our website as a blog, and I would definitely share out en masse via our Facebook page, our Twitter account, as well as our Instagram account. So again, I understand people are well-meaning, but right now it is resource overload. It is much too much for any one person to kind of navigate. Even the most savvy, I think I'm kind of savvy in terms of I'm a sheer, natural connector, and I'm having an overwhelming experience of looking at all of this. And I have reviewed a lot of resources and put them in this blog. And then the last part of kind of navigating resources is for the individual, right? So individuals are trying to think about, oh my God, how do I apply for unemployment? How do I get access to food? How do I get, parent, student resources like opportunities if I'm an artist. So I provided some key resources that I found that are like amazing clearinghouses for anything you can imagine, right? As an individual that you may want. I've also added a link to just all the mutual aid fund efforts of people just coming together to create funds to give out to individuals that need a rapid response, like assistance, like right now, like I need some funding, some assistance right now. So I've provided that. And again, in an effort to help us all navigate these resources, because right now it's overwhelming. And again, what happens to the person, the organization, is they just kind of check out for a while, which means that they aren't clicking on and getting the resources that they need because it's just overwhelming. So please check out that blog around navigating COVID-19 that we're going to put up. Again, I've kind of mined hundreds of resources that I found, and these are the resources that are kind of my top picks as you think about the things that you need to sustain your work, your community, and your personal lives. All right, so call to action. So again, as I think about as I've shared, right, that COVID-19 is not an equalizer, I'm really calling all of Black social justice leaders in the South. We are looking for your feedback on healing and emotional self-care services that you need. because we understand that you are essential. Literally, a lot of you are still are working on the front lines, probably more now than ever because your communities are suffering more now than ever and needing your support, but we also know that you need support. And so we would love for you to take a survey, be a part of a focus group so that we can hear from you, so that we can be responsive to your needs and provide services to you as you are dealing with this, going through this, and supporting community. So I'm gonna take this off. I know I have it here kind of in presentation mode, but I want to share the website with you all on how you can get connected to the survey, at least to the survey. So it's on our website. This is the link, communitybuildventures.com/new-way-to-thrive/. And so definitely check this out on our landing page. You can simply click here on take the survey, and it'll take you directly to the survey. Each person that completes the survey will receive a free subscription to our online service called Get Out of the Fire. Get Out of the Fire is a resource to help people move past a feeling, the feelings of being burnt out, overwhelmed, and over it. And so we're offering this as a free resource of anybody that completes the survey. I'm pulling it up here. It is on our website here. When you go to our website, this is information about it. What you receive as a resource is information on what is happening to your body, your brain particularly, when you are in flight, freeze, fright zone. And then there's a workbook to kind of help you navigate as a tool around self-care to navigate through those feelings. And then there is breathing exercises to also help you as you learn how to get out of the fire, right? As kind of a daily routine to really understand and unpack stressors and how, and how you're facing those stressors so that you aren't continually being overwhelmed, overworked, and over it. The other, so again, please, if you're a Black social justice leader in the South, right? In the South, we're talking about all the way from Louisiana, Kentucky, through West Virginia, and including Florida, all through the South. Social justice leaders, right? You're movement builders, you're centering racial equity, and you're trying to transform, disrupt, dismantle systems and structures that are harmful, particularly to Black and brown people in the South. And again, as I say Black, I'm talking about the African diaspora, Afro-Latinx, people from the Caribbean, all of those people, again, from the African diaspora that are socially interpreted as Black. And so we definitely want you to fill out that survey. The next thing is our dear friends at the Black Emotional and Mental Health Collective has provided a listing of phone resources around mental health, right? Different helplines to help you if you're having, some mental health challenges and you just really want to talk to someone, really to process it through, and or you just want to get connected to resources locally in your community that may be helpful around psychotherapy and other mental health and other mental health and other self-care services. So want to leave that here for a couple of seconds so that you can see that. You can pause the video, of course, to jot down these things, but just wanted to add this here. And then here's the thing, COVID-19 testing, right? I talked about the disproportionality of Black people and brown people that have contracted and died from the disease. So I want to offer up this resource, CVS Minute Clinic. If you're in Georgia, Massachusetts, and Rhode Island, you can potentially get access to the test at no cost, right? There is a brief survey right here at the top. You see the web address to which you can access the testing and getting information from CVS Minute Clinic. You do have to take a brief survey online to qualify first to get the test. I know in Georgia, the Minute Clinic near, I believe, Georgia Tech is offering the test, but again, you have to get approved first to then go down and get the test. So I'm leaving that here for a couple of seconds. Again, you can pause the video right now and pull this up. I will also share that go to your local Department of Public Health, Department of Health, to see what they are saying about getting COVID-19 testing. When I went to the CDC site, it only talked about like how you qualify, what are the symptoms, things like that, but not necessarily where you can actually get the test. What they say is go to your local public health, your state, to get access to this information. I will say so far, and again, if you have resources that you found around getting tested, please share here in the comment box. But this is one of the first private companies, right, that I'm hearing that are providing the testing. I know LabCorp is saying, hey, we offer the test, but you have to be referred by a medical provider, which is also sometimes hard for people to navigate, especially people in Black communities to navigate, because you may not have a primary care physician. Your options right now for a lot of folks is, hey, I'm going out to the emergency. I'm going to go out to the emergency department and get access to care, which honestly is traditionally for a lot of Black folks, that's what they do, but that is not really an option, right? So I would say in Georgia, Massachusetts, and Rhode Island, here is a resource. If you're listening to this, please share if you know of other resources that you come across around getting testing. No matter where you are in the country, we want to hear it because we want to lift those up so that people get access to testing if they need it. All right. I think this is all I got today. And I appreciate you reviewing this video, clicking on this link. I will note that I apologize for whatever reason we couldn't maintain the live feed on Facebook Live. I'm going to continue to work through that and figure that out. So when you get this video, you will note that the start of this video is a little strange at the start. However, this video contains all of the information that I shared in terms of the reality that of COVID-19, the resources, as well as articles, and again, we will share some navigating COVID-19 resources via blog also. Please share any resources that you've come across that have been very useful for you, especially access to testing. And so I'll sign off for now. Again, have a beautiful rest of your day. Remember to drink a lot of water. Get a lot of rest, right? You need a lot of rest during this time. And whatever rest means to you, that could be a nap, that could be just lying still, whatever that is, listening to soft music for 15 minutes, whatever that is, please take time to rest and take time to exercise. Go outside, take a walk, okay? Until tomorrow morning at 8 a.m., again, I'm gonna try this live thing again. Be well and take care.